Hi there, folks. So, I want to come on and talk to you about the tests that are being done for the COVID-19 strain of coronavirus. So important at the moment because those actual tests are being used to confirm the alleged amount of viruses that are used to claim that there's a pandemic at the moment. And of course, it's that is justifying the measures of social distancing and of all the shutdowns and all the lockdowns too. So it's really critical if we are using those tests as the basis to justify all these widespread measures with such profound effects on large numbers of people. We need to know whether those test results are actually accurate or not. And it's so important. And actually, the information I'm getting is quite varied at the moment. All sorts of different information that is questioning the reliability of it. So it seems to be maybe there are several different tests as well. But in terms of the recent tests, I don't know about, I know that there are some that are now being manufactured, new ones. So I don't know about what's being said about those because it's still too early potentially to say, but I haven't heard information about that yet. But I know that there's a lot of disputes about the authenticity, how reliable those tests are. Well, in actual fact, it says on the tests, some of them that are sent out, and the CDC even say, and I quote, positive test results are indicative of active infection or co-infection with other viruses. The agent detected may not be the definitive cause of the disease. So there, in that paragraph alone, it admits that it's not a definitive proof that it actually is that particular strain of infection and not some other disease that could be causing those symptoms. And there's a lot more information than that, actually. In April, the CEO of a drug company, that I think they're called Roche, and their CEO, Severin Schwan, well, he was quoted in a Reuters news article as saying that the new antibody tests for the COVID-19 were a disaster, in his words. An article for Fierce Biotech, who are a pharmaceutical industry, they claim that, and I quote, a large number of potentially inaccurate tests enter the market fueled by sky-high demand. Many countries are seeking serology tests to understand whether people are developing a possible immunity to the novel coronavirus. But reports detailing high rates of false positives and false negative results are displaying widespread screening. These tests are not worth anything or have very little use, Schwan said during an early Wednesday conference call regarding the company's first quarter earnings, and that was according to Reuters. Some of these companies, Schwan says, I tell you, this is ethically very questionable to get out this stuff, he said, adding that Roche analysed several products currently on the market and found them to be unreliable. Now, Roche, the pharmaceutical company, is currently developing its own antibody tests, set to be launched in early May, and they may well be launching soon. So there is a pharmaceutical company themselves saying that they have doubts about how reliable those tests are, so much so that they want to manufacture and develop their own. The scientist who actually invented those test results, the PCR, as they're called, now he was speaking about the use of PCR, and he said, and this is a quote about the late scientist Kary Mullis, who said, quantitative PCR is an oxymoron. PCR is intended to identify substances qualitatively, but by its very nature is unsuited for estimating numbers, that is the viral load. These tests cannot detect free infectious viruses at all. The tests can detect genetic sequences of viruses, but not the viruses themselves. So that would indicate perhaps, if that was at least true for this test, and I'm not totally sure if it is, that would then indicate that it couldn't determine what specific strain of viral infection it actually is or not. Well, now, Chinese researchers at the Department of Epidemiology at the Biostatistics School of Public Health, they conducted a data analysis of the RT-PCR tests, and they found an 80% false positive rate. Meanwhile, there was a study done at the Queen Mary Hospital at their Department of Microbiology, and that was at the University of Hong Kong, and they found a wild variation in the RT-PCR accuracy, and they found it to be between 22 and 80% reliability, depending on how well it was applied. The general unreliability is also confirmed by other studies too, and most studies are indicating the RT-PCR failure to detect C19 in symptomatic patients, and these are so-called false negative tests. Well, we've heard quite a lot of reporting about people that have got the disease or symptoms but are testing false negatively for it. But we're also hearing other studies showing that there are positive as well as negative false results. So, it's very hard to sort of know. And then recently there was a viral video of the Tanzanian leader, I think it's their president or their prime minister. Now, he claimed that he had ordered a blind test to be conducted, and they used the subjects for that, various animals and also plants, and that he claimed as a result of that study that there were various birds, there were animals, including a goat, and even fruit that were being tested and coming out with positive results for COVID-19 coronavirus. Now, if that turns out to be true, then that would completely undermine it at all. Then the test doesn't even distinguish whether it's a coronavirus or COVID-19, or even whether it is some kind of infectious disease, whether that's coronavirus or another type of virus. Then it has a complete meaninglessness. So hard to know, really, when there are such different reports, and there are various doctors' reports that I've read that are disputing as well the authenticity and the reliability of those various test results. So I do have my doubts based on the various reports that I've heard, and it's really quite hard to know. So quite worrying, considering that so much faith has been put in those test results, and that they are being used to justify a belief in a pandemic, which itself is being used to justify the whole variation of policies that encompass the social distancing, the shutdown of many businesses, the legislation making it criminal for various groups of people and large groups to meet up, and the shutdown of many organizations, businesses, and of course, the advice to sort of stay at home that's being repeated, and all the lockdowns in other countries where people are not actually permitted to leave the house or being strongly regulated and only allowed out with permission and with certificates to prove that. So really quite concerning that all that's going on, and the actual evidence to justify the actual alleged pandemic, to warrant that extreme reaction, that itself seems to be disputed from a wide variety of different sources. So it really is quite concerning.